Did you know that some of the medications we take every day could actually be harming our memory? If you or someone you love takes medication for chronic conditions, this video might be the most important one you watch today. We all rely on medications to help us manage our health, but there are certain commonly prescribed drugs that can trigger rapid cognitive decline, especially in seniors. If you're noticing forgetfulness or confusion, or simply want to know if the medications you're taking could be affecting your brain, stick around. In this video, we'll explore 9 popular medications that can trigger rapid dementia. Let's dive in before it's too late. Now, you might be wondering, how can a simple medication cause such a big impact on our brains? Dementia, as we know, is a progressive condition that affects memory, thinking, and behavior. It's not a normal part of aging, but rather the result of changes in the brain. As we age, our bodies and brains undergo changes, and some medications can speed up those changes, leading to cognitive decline. But don't worry, this video isn't meant to scare you. It's meant to inform and empower you. Now, let's get into the heart of this video. 9 commonly prescribed medications that have been linked to rapid cognitive decline in seniors. Each of these medications can have a profound impact on your memory and brain function, especially when taken long-term. Let's go over them one by one. 1. Benzodiazepines, anxiolytics, and sedatives. These medications, which include drugs like Xanax and Valium, are often prescribed to treat anxiety, insomnia, and other mood disorders. However, they are known to cause memory loss and confusion, particularly in older adults. They slow down the brain's function and can contribute to cognitive decline if used for extended periods. 2. Opioids, pain relievers. Drugs like morphine, oxycodone, and hydrocodone are commonly prescribed for chronic pain. While they are effective for pain management, they come with a significant risk of impairing cognitive function. Opioids can cause drowsiness, confusion, and even contribute to memory loss, particularly in seniors who may already have mild cognitive impairment. 3. Antihistamines, allergy medications. Common over-the-counter allergy medications, such as Benadryl and other first-generation antihistamines, have been shown to impair cognitive function. They work by blocking histamine, which can lead to drowsiness and confusion. Long-term use of these medications in older adults can increase the risk of developing dementia-like symptoms. 4. Beta blockers, blood pressure medications. Beta blockers, used to manage high blood pressure and heart conditions, can also have cognitive side effects. These drugs can reduce the blood flow to the brain and may cause memory loss or difficulty concentrating. For seniors already at risk for cognitive decline, beta blockers can make the situation worse. 5. Antidepressants, selective serotonin reuptake inhibitors, SSRIs. While antidepressants like Prozac and Zoloft are effective at managing depression, they can also impact memory and cognitive function in some seniors. These drugs alter the brain's chemical balance, which may lead to difficulties with focus and recall. 6. Anti-diabetics, diabetes medications. Drugs used to control diabetes, such as metformin and insulin, can also affect brain function. Low blood sugar or sudden changes in glucose levels can cause confusion and memory loss, especially in older adults. It's important for diabetics to monitor their blood sugar levels regularly to avoid cognitive issues. 7. Parkinson's disease medications. Medications like levodopa, which are used to treat Parkinson's disease, can have side effects on cognitive function. While they help manage movement symptoms, they can also cause confusion, memory issues, and hallucinations, especially in older individuals who are more sensitive to these effects. 8. Statins, cholesterol-lowering medications. Statins are widely used to lower cholesterol levels and reduce the risk of heart disease. However, there's evidence suggesting that statins may affect cognitive function, particularly in seniors. Some individuals report memory problems and difficulty concentrating while taking these medications. 9. Antipsychotics, used for mental health disorders. Used to treat conditions like schizophrenia and bipolar disorder, antipsychotics can cause a range of cognitive side effects. Seniors taking these medications may experience confusion, memory loss, and even a general decline in mental sharpness over time. Each of these medications has a place in medical treatment, but it's crucial to be aware of their potential impact on cognitive health, especially for older adults. Now that we've covered some of the medications that can trigger cognitive decline, let's talk about how you can minimize their effects. Here are some practical steps you can take. Review your medications regularly. It's essential to sit down with your doctor at least once a year to review all of your medications. Your doctor can help you understand which medications are most essential and which ones might be causing unwanted side effects. This is also a great opportunity to discuss potential alternatives or adjustments to the dosages of certain drugs. Ask about non-drug treatments. In many cases, lifestyle changes, therapy, or alternative treatments can help manage your condition without relying on medications that might affect your memory. For example, physical activity, cognitive training exercises, and stress management techniques can be powerful tools in improving mental clarity. Take medication as prescribed. Avoid changing the way you take your medications without consulting your healthcare provider. Sometimes, even small adjustments to how a medication is taken, such as splitting doses or taking them at specific times, can reduce side effects. Watch for drug interactions. Many seniors take multiple medications at once, which can increase the risk of drug interactions. Make sure your doctor is aware of all the medications you're taking, including over-the-counter drugs, supplements, and herbal remedies, so they can identify any potentially harmful interactions. One senior I spoke with, for example, started feeling unusually forgetful after being prescribed an antihistamine for allergies. She discussed it with her doctor and switched to a non-sedating alternative. After a few weeks, she noticed a huge improvement in her memory and overall well-being. These kinds of stories show that small changes can make a big difference. The key is communication with your healthcare provider and being open about any concerns you have. To wrap things up, it's crucial to be aware of how the medications you're taking might be affecting your memory. The 9 medications we've discussed are linked to cognitive decline in seniors. But with the right precautions and open communication with your doctor, you can protect your brain health. If you found this video helpful, please give it a thumbs up and share it with your friends or family members who might benefit from this information. Don't forget to comment below. Have you or someone you know experienced memory issues with any of these medications? Let's keep this conversation going. Remember, your health is in your hands.